Hey A&P students, welcome to our series of videos about the cat vasculature. So right now we're going to do a couple of sets of videos over areas of the cat, looking at the arteries and veins in that area. Do note these cats are the vessels have been injected with plastic that is colored. The blue color is veins, and the red or pinkish or light pink color are the arteries. Note that the colors in the arteries are not as bright because the walls of the arteries are thicker than the walls of the veins. So you can see much more blue color in the veins versus the arteries. Okay. Also, these cats are triple injected, and we'll see this when we get to the thoracic region, that the hepatic portal system is colored yellow. Alright, so what we're going to do is just start off here in the chest, and we're going to go from the heart and look at the branches from the aortic arch. We're also going to look at the branches of the superior vena cava. So just to orientate ourselves, we have the heart here in the picture, and we're going to work our way towards the neck region or cervical region of the cat. Here we have, and again, as I go through, sorry, didn't mean to start there, but as we go through the vessels, I will try to point out the differences between the human and the cat, and I will try to point out any kind of structures that might be missing during the dissection that I dissected out of the cat and removed. Alright, so again, here's the heart. What we're going to do is we see from the heart, from that left ventricle, the ascending aorta, and then the aortic arch. Note here there are two branches. We'll start off here with the arteries, of course, from the aortic arch. This is oxygenated blood. These two branches of the aortic arch. This is a difference between cat and human. The cats have two branches, the human has three. Notice also, if you looked at the sheep heart or pig heart videos, pig hearts or sheep hearts, they both have the two branches. Alright, so here we have the two branches. This first branch, larger branch, is the brachiocephalic artery. The second branch leads up to, and this branch is called the left subclavian artery. If we follow the left brachiocephalic or the brachiocephalic artery, follow it up, we will notice some other branches. What I am going to have our assistant do is move the vein here, the superior vena cava, away so we can follow these branch points. So, this brachiocephalic artery then branches into the two common carotid arteries. We have a left common carotid and a right common carotid artery. Notice that this also branches into the right subclavian. It's kind of difficult to see under there, but here we go. I'll lift it up. Oh, sorry. Here we have our right subclavian artery. The right subclavian artery, then, as we'll move that vena cava out of the way again, the right subclavian artery follows under that vena cava, and you notice here you have a branch that would follow and trace up into the chest wall, and that is the internal thoracic or mammary artery. Okay? Alright, so we'll move back towards the aortic arch, and then come back up the left subclavian artery. Sorry, there's a nerve right there. So this is the left subclavian artery, and you can kind of follow that up. Alright? So, and again, back to that aortic arch. If we go follow that aortic arch around, notice we enter as the aortic arch starts to go back down through the thoracic cavity. This is referred to as the descending aorta. Branches of the descending aorta, you have these small branches that work between the ribs, go between the ribs, and these are referred to as the intercostals, hence the going between the ribs, their location. Okay, and you have several intercostals all the way down the descending aorta. Okay, so now we're going to move on to the veins of the above the heart, and so we'll kind of move the heart over just a smidge so we can see that superior vena cava. So notice here you have, this is the auricle. This is the auricle of the right atrium. So notice here you have the the superior vena cava. Alright, now superior vena cava, the first initial branch there you're probably going to notice is this branch here, which has been broken, has been torn away from its structure. But this would be the internal thoracic or internal mammary vein. And so here, notice that's that first branch off of the superior vena cava. The superior vena cava then follows up towards the head and branches further into the brachiocephalic veins. So these first two major branches are brachiocephalic veins. From those brachiocephalic veins, if we look here towards the left brachiocephalic, notice you have this major branch off of the brachiocephalic, left brachiocephalic. This is actually the vertebral vein. Yes, the vertebral vein. I'm sorry. The vertebral vein. And notice it's a pretty large vein. It's not on your list, but I just want to point it out. So that you're aware of that branch right there. If we follow along, though, however, this brachiocephalic branches into the external jugular vein here and would go up until it reaches the head. Drain blood from the head. And so that's your external jugular, and then this branch here would be your left subclavian vein. Okay, so we'll go back to where the superior vena cava branched to the brachiocephalics. Here's our right brachiocephalic, and it branches again into, and you can't really see the vertebral on this side, but it branches into the right external jugular and the right subclavian. All right.